laboratory staff certainly was concerned that they were going into a place that if anyone was going to have a concentration of COVID cases, it would be a hospital.
There was a commonality around trying to keep everybody safe at the same time of caring for these patients who became very, very sick, and a high level of patients who were passing away. All of that pays a tremendous toll on each and every one of our caregivers here.
When the first cases were identified in the United States, we were as worried and as scared as any other person who doesn't work in the clinical setting. But we realized that we needed to keep going because this is our job.
The first day that we have to run this test, obviously everybody was really scary. We didn't know what's going on, how it's going to be transmissible, if we need to take extra care.
We had situations where we had employees that got COVID, so they were out of work for 2 to 3 weeks at a time sometimes. Everybody had to help at some point to help a teammate get through it.
We had not only testing platforms that had to be started up and validated, but we also had testing supplies that were difficult to obtain during that time period because everyone wanted them.
Bringing on new instrumentation in the laboratory generally takes several months, but with this pandemic, we didn't have time. We were able to bring in this automation and have it up within weeks.
They had to get these machines on, validate them as quickly as possible, keeping everybody safe, but didn't have the luxury of time.
We were getting the equipment on Monday, and over the weekend, our facilities team was in the lab actually breaking down walls, creating the space so that when equipment got delivered, it could be placed and ready for the engineers to, put together, start validations.
Hospitals are fairly large sort of ships. They usually are very hard to turn and take a long time to change culture, change practice, etc. This was turning on a dime.
We changed from testing some symptomatic patients to testing all symptomatic patients, asymptomatic patients, people who had been exposed and were worried about their COVID status.
We were spending a lot more time here versus our families, and that was just a sacrifice that a lot of us made, just to take care of our patients and take care of each other.
It's kind of challenging, but then it feels like rewarding at the same time because you know that you're helping the patient a lot more.
It feels very gratifying to know that what you do is important. I still think the rest of the world doesn't realize that everybody wants a COVID test, but that it's med techs that do it, medical technologists.
They are the unsung heroes because you don't see them, right? The specimen goes up to the lab, it somehow gets done, but you don't really see the people who actually have done the work and made it successful.
Lab's always been in the background. We provide the results for the physicians, and then they make clinical decisions. And so COVID really brought what we do to the front because what we did really impacted the operations of the hospital.
It is an honor to have this team of heroes to work side by side to change the world.